Good morning, everyone, and welcome to AC 26. It's fantastic to see everyone united in this room. So let's begin with some critical housekeeping. As many of you know, we like to start our gathering with a motto: you belong here. This incredible organization grows stronger through every unique perspective and background in it. The most powerful solutions to the challenges we face emerge when people who see the world differently commit to solving them together. The work you do sits at the center of healthcare's future, and none of you should have to carry that work alone. HFMA is here for you. I cherish this room every year. It's a moment to unite on where we are and where we are going. It is our recentering and a renewal. So let's start with where do we find ourselves? You live and feel these forces every day. Reimbursement models are shifting, margins are strained, payment models are transforming but need know-how, policy is in flux, long-range planning is uneasy, and the administration, they are not afraid to make waves and push new behavior for all stakeholders. The workforce is shorthanded, exhausted, upskilling, cross-skilling, and rising remarkably in cost. The population is aging, employers are impatient, and the public is no longer asking politely for transparency and better pricing. They are demanding it with the same consumerism expectation they bring to every other industry that competes for their trust. And what's converging on this industry from the outside? Extraordinary. Artificial intelligence has moved from a future consideration to an operational imperative. It lives inside the revenue cycle, clinical workflow, strategic planning functions, and moving at speed beyond the design of existing governance structures. The returns on the horizon, they're real, as are the risks of falling behind. And the companies building infrastructure, not legacy health IT vendors. Big tech has arrived with cloud scale, data architecture, and AI capability that no health system built organically. And that's before quantum computing rounds the corner to potentially redefine medicine itself. We have a generation of innovators unburdened by tradition and unintimidated by complexity. They are here with appetite and conviction. And PE and VC will follow with outcomes-linked capital and risk-sharing models that rewrite all the rules. All of this. The pressure and the possibility are simultaneous and accelerating with gusto. So last month, HFMA surveyed top executives and thought leaders across all facets of healthcare to take the industry's pulse. We asked whether the US healthcare delivery model had reached or within the next 3 years would reach an existential tipping point. 77% said yes. That's a 23% increase from just 18 months earlier. 90% of those respondents agreed the current system is financially unsustainable. Economic history documents this pattern with uncomfortable consistency. Pressure builds, institutions absorb it until they can't. When the tipping point arrives, it rarely comes as a managed transition. It comes as rupture. What follows reorders leadership, competitive advantage, and the fundamental logic of how an industry operates. Every industry that believed itself too essential to transform eventually learned otherwise. So what does the existential tipping point look like for a fragmented system responsible for the healthcare of 330 million Americans and on a trajectory to exceed $6 trillion in expenditure? That's the weight and the energy of this moment.